We call upon Dr. Sanath Hettige, the President of the IMPA, to deliver a presentation on integrating anti-aging care into core clinical practice.
Good evening, everybody. I'm honored to have you here all listening to this presentation. As the president of the world's oldest national organization for private medical practitioners, the IMPA, I am honored to share with you a new vision for the future of medicine. The vision is not only for the Independent Medical Association of Sri Lanka, but also for our colleagues around the world. Today, I want to introduce a new approach to treatment. While the idea is not entirely new, it has not yet been widely used in our medical practice. It is integrating anti-aging care into core clinical practice. This topic is becoming more important than ever since Sri Lanka, like many other countries, now has a growing elderly population. According to the statistics, in 2022, the global, we had about 10% of the total population worldwide were over 65 years of age. I think Sri Lanka in 2023, it was 11.74. I think it would have gone up further. So we often, as doctors, we often focus on treating individual illnesses. But we also need to think about treating the aging process itself, which is the root cause for many illnesses. When you consider age, there are two ages, that is chronological age and the biological age. Our approach is to reduce the biological age. We cannot reduce the chronological age. Now, actually, why do we age? It's common sense that everything in this world is not permanent. Everything has to decay and perish. Same is ourselves. We are made of proteins, carbon and nitrogen, so the molecules can change. And just take an example of a car. Once you buy a car, after some time, you will have to do repairs. Certain parts you can repair, certain parts you have to replace. It's same with our living organisms, or it's the same thing with us. But only thing, living organisms have the innate ability to do its own repairs from the carbon dioxide that we breathe in and oxygen and the food we take. Certain compounds are made, and they are made, can do the repairs. But there will be a time where the replacement and repair can't, is more than the demand. So that is when the aging happens. So if we can put this anti-aging care into our clinical practice, we can have tremendous impacts on Sri Lankan healthcare. As our honorary health secretary is here, he will, I am sure, will take notice of this. So impact of Sri Lankan healthcare, we have economic benefits like lower national health expenditure. We can have fewer admissions, shorter hospital stay, reduced need for institutional care, extended workforce. The people gain knowledge with time, and if they are healthy, they can contribute more to a nation. Because even at the age of retirement age, many of our doctors are capable of serving the country with a lot of experience. That is where IMPA also stands. We have a lot of experienced consultants here who can give the pathway to the national health of Sri Lanka. So we have to keep them fit, and we can reduce the family cost. Then healthcare system benefits. We can relieve the hospital pressure, reduce chronic disease burden, improve care and quality. So these are the health benefits, impact on Sri Lankan healthcare. We can get, if we can introduce this anti-aging practices for our healthcare system. We have social benefits also. We can keep elders independent of engaged in communities, preserve integrated support systems and reduce burden. So this is simply to see how the cancer increases with age. Now this is the age, the chronological age and the biological age which I was talking about. We have two ages. One thing is the chronological age, the other one is the biological age. Chronological age we cannot change, but the biological age definitely we can reduce. A lot of us, people's biological age actually does not match with chronological age. If you get somebody 50 years, his biological age could be 40. But there are some individuals who are 50, but their biological age 60. So I think the way to judge the age is the biological age, not the chronological age. I think in future, this will happen when it's considered for jobs and things like that. Fitter and biologically age reduced people, I think, can work more. In most of these developed countries, I think now they are considering biological age. And another one thing I would like to suggest, because there are all top distinguished people here, that nobody actually, once you have passed the age of about 25, like to tell your age. That's a fact. So, but in our country, from our identity card, anybody can know the age. I think age is a very private thing, and it should not be relieved in the identity card. There are many countries where the age is not indicated in the identity card. This is just a suggestion, because I have experience in trying to get the patient's case histories. When you pack them according to the age, a lot of people say less age, so you can't find the cards. So therefore, it's just a suggestion. Yeah, we propose a two-pronged anti-aging strategy for young individuals and for older individuals. For young individuals, we have to prevent aging before the damage sets in. Focus on lifestyle preventive care and to keep the biological age less than the chronological age. So it's best to begin when you are young. Even for older individuals, there are new methods which can reverse their age. Reverse some aspect of aging, improve strength, energy and immunity, low biological age through interventions. So this is our plan. Actually, this have to be taught in schools, the importance of anti-aging, to have better lifestyle practices, how to slow down wear and tear before it starts, health habits that protects the body from early age, that keeps from functional disease free and youthful. Because nowadays, our school children are addicted to cell phones and they don't like to go and play or do physical activity. So this will have a very bad impact. So at school age, if we tell them to become young, to become more smart, to become more attractive, so if you put that idea when you are young, they will practice this. Now, during my past 20 years of clinical practice, I have seen some individuals, if they were taught about anti-aging care, they would have been more active at their age now. We'll go a little deep into what is biological aging. Primary factors is the main cause, which can lead to antagonistic and integrative effects. So in primary root causes, there is genomic instability. DNA breaks and mutation builds up over time. Telomere shortening, protective chromosome end shrinks, each cell division, limitation of how cells can divide. Then epigenetic alterations, gene expression changes. Gene expression is misregarded due to changes in chemical tags. Genes get mutated on and off. So there is wrong messaging. This is another one. Loss of proteostasis. Our body actually functions through a lot of enzymes and proteins. So these we cannot manufacture this protein in the same way. Then disabled macrography, that is self-cleanup. Our body has unique ability to get rid of cells which are not being used. But with aging, we won't be able to do that. Then because of these primary causes, there is faulty responses. There is deglutenated nutrient sensing. That is, for example, like in diabetes, what happens is we have insulin, but it's not acting properly. So the signals are not working properly. Then we have mitochondrial dysfunction. Mitochondria are not working properly. That is why with age, we feel so tired without doing anything. Then cellular senescence. That is, there are a lot of unwanted cells in our organs, right? Normally when we are young, they are being taken out. But with aging, they are not taken. So damaged and unwanted cells are there. It is like having unwanted people in an organization. They can disrupt the whole organization. So these are the things that come up. And they are the most important things. System ultimately tend to break down. We have stem cell exhaustion. You know, we have stem cells in muscle, in kidney, in liver, everywhere. So they get activated, as I said, when cells need replacement. But with aging, we have exhausted the stem cells. Altered intracellular communication. So the messages are from cell to cell, it's not clear. Different type of messages are sent. Then chronic inflammation. With age, there is chronic inflammation happening. That is why a lot of people complain of body pain. It's a very common complaint that we get because there is inflammation inside the body. Then dysbiosis. The gut microbiome shifts, go out of balance, and worsen immunity metabolism. Recent research have shown that we are not living alone. There is a lot of organisms in our body. We have symbiosis. So this gut microbiome has to be known of lot importance. So with aging, it changes. Maybe in a undesirable way. I can remember when we were small, every holidays we are giving a laxative. It is Aralu, I don't know. We used to give, and our parents used to give it at least by force. So we purge for one day, and food also is not given, not anymore. But this was stopped. I don't know whether this had some effect in changing our gut microbiome. So there are a lot of things that we can take from our ancestors also. So what happens, as I said earlier, all what I have said lead to this. The body maintains itself by two strategies. Repair, which is fix existing cells. Neuron, cardiac muscles, eye lenses, inner ear, hair cells, skeletal muscle fibers, they more are repaired rather than replaced. And there are certain other aspects where our cells are replaced, like skin, gut, blood cells, hair follicles, and bone cells. Aging is not a wear and tear. It's when both repair and replacement can't keep up with the damage. Right. So what we do in our clinics at the moment, we treat hypertension, not vascular stiffness. We treat memory loss, but not mitochondrial decay. We treat blood sugar, not insulin resistant, due to senescence. What if we treat the aging that causes all this? This is the model that I am proposing. That the traditional model is focused on diagnosis and Medicare, mostly. It's disease-based, reactive and reductionist. Doesn't address why aging accelerate, only treat symptoms. But the new approach is a holistic, anti-aware approach to care, combat disease management, and add anti-aging interventions also. We quite successfully do combat disease management, But what we don't do is anti-aging interventions with that. Treat the illness, slow the biological clock, do both. I will tell you how you can do later. Think in terms of health span, not just the lifespan. Start aging assessment by age 35 to 40. Consider age care plans for every chronic patient. So, every patient, we can actually see where they stand with their biological age. These are some of the tests we can do, but I don't think most of these tests are available here. To see your proper biological aging, you can do epigenetic clock test from blood and saliva, then telomere length, phenotype type aging. Certain other tests we can do actually, functional tests, physical fitness, cognitive testing, and imaging of the brain. So, what I propose is that as the doctors, we not only treat the illness, we see what anti-aging practices that we can put on to these patients. Actually, definitely, we can do this. Not that our doctors are not thinking of that, but it has to take more seriously. For example, if you have diabetes, we have gone to the high end of sulfonylureas, we can't do anything. But have we told them to do some exercises, walk 1 hour a day, do some strength training exercise, and then come back and see. And what we do is increase the dosage, then go to insulin. But if we stress them, any of your patients, you get them to walk 1 hour for a day for 1 month and see the response. And also improve your muscles. We must stress on those points rather than only medicine. There are a lot of other things you can do. So like that, there's a lot of anti-aging practices which can give to our patients. So these are the core intervention that slows aging, which have been proven by research. We all know this. Doctors know, but we don't insist that much on this. We have to explain the patient well and insist that they do this, they can have this achievement. In my past 15 to 20 years of clinical practice, I have taken special interest in anti-aging. I have seen people who look younger with their age, and I have asked them what they do when compared to people who look older than their age. I have done observational studies, and I have derived so much of data on these aspects. So caloric control, intermittent fasting is definitely beneficial. For the past 3 to 4 years, I have a lot of my patients trying intermittent fasting, and definitely they have benefited. Even me, I take only 2 meals a day and try to restrict for 1 meal for the past 4 to 5 years. And that has given me lots of benefit. There are a lot of my patients who have gained that. And certain food, what we eat is also important. We have to eat very low amount of carbohydrates. So the other thing is sugars. It's also very important to cut down on sugars. And vitamins, micronutrients in aging. High dose vitamins are very helpful. I have observed in my patients. For the past 20 years, every patient I have kept records. For aged people, I give high dose of vitamins, which have tremendous effects. When we were medical students, we were taught that vitamins are not much helpful that for disease. Because when we check the blood levels, the vitamins are normal. But most of the vitamins are not in blood. They are in tissues. So blood level does not correlate. Giving high vitamin doses has tremendous effects, like certain vitamins specifically as vitamin D, vitamin A, and magnesium, zinc, have very pronounced effects which need more investigation. And the stress management. Now, our body is unique. And if we think something, our body knows that this man needs this. If we think we need to be younger, we need to be more active, our body itself make arrangements for this. If we think we need to retire, we are not going to do anything, now we are 65 years old, then the body doesn't help you. Body actually can help you. The scientific research have shown this. For example, if you are taking a walk every evening by about 5 o'clock, the body has mobilized its fatty acids and certain things into the blood around that time every day. If you go to a mirror and if you think, I want to be pretty, I want to look younger, you become young. This is proven. People with strong sense of purpose, 7 years, live 7 years longer and optimize, reduce all cause of mortality. Strength training, aerobic exercises are another thing that is most important, and we tell patients, but we have to insist them the importance of this. Now, there is sarcopenia, loss of muscle, fibers with aging, because of our stem cells are depleted in muscles. But if we do exercise, trauma to any organ is one way to stimulate this stem cells. That is why you do microneedling to your face to activate fibroblasts. So therefore, if you give trouble to your muscles, it start working. So if you tell your elderly patient, at least to stand and get up from where you are seated 20 times in the morning, 20 times at lunchtime, 20 times in the evening, you can definitely prolong the bedridden or the age that they definitely will be unable to walk. So there are simple things that you can do. And muscle training exercise. Get a 2 pair of dumbbells and do some exercises. We are developing muscles, and that definitely help to reduce insulin and other things. I think exercise is one of the most important aspects of reducing age. There are target pharmaceutical inventions. Anyway, because of the time factor, I am not going to go into details. There are a lot of exciting drugs which are there, and there are some common drugs which is in the market, like metformin, telmisartan, and statins, which are helpful in anti-aging activities. I have seen people who have taken statins for a long time looks healthier. Simply because not only the anti-inflammatory effects, when you take statins, the atherosclerosis is reduced. Therefore, your organs are better perfused. With aging, if you check, your endocrine levels are less. Your growth hormone is less, your testosterone is less, your estrogens are low. So if you give them this, they improve. I know you can give testosterone gel in gel form to elderly individual. They have definitely, it improves their muscle strength, their ability to work, their sleep. So there are so many things, new things, which we can use on our patients, new medications. This is how they act but unfortunately, I have no time to go through this, but this presentation will be available in a website, which I will give you the web link, and you can go through them. So there are emergent therapies like stem cell therapy, gene therapy, partial cellular replacement, plasma exchange, young plasma factors, tissue engineering. I would like to talk only about two things. The stem cell therapy is being practiced world over now for certain diseases, not for anti-aging properties, but I'm sure that the stem cell therapy will be a new method ahead. Plasma exchange therapy. Now actually, when patients are seriously ill in a hospital, you have to consider them giving as much as possible blood of young patients. I mean, I'm not referring to blood of children, but more young patients and more fresh blood. This has other benefits than simply giving blood or plasma. They have some precursor cells, they have some, because you match the blood, they have some stem cells, and you can have tremendous improvement in really patients if you can give young plasma factors. Just take, so what is our new approach? Now if somebody comes with 55 with this body pain and weakness, most of us give NSAID, AIDs, and maybe with antacid. Of course, we may give some vitamins and also investigate. We are not saying, but we don't concentrate on anti-aging approach, where you tell them to do intermittent fasting, where you give them high dose of nutrient supplement, you give them adequate sleep, physical activity, and we can give them hormonal treatment. Not that our consultants, we know all this, but we don't really think about these things of doing this anti-aging aspect of care. This is a house analogy which I have demonstrated, or I'm thinking of, like patient is a house, right? If an electric switch in a house breaks, what we normally do is we fix the switch. We don't think about the roof. We don't think about the windows. We don't think about the painting. Maybe sometimes we think, but mostly we don't. But what I'm saying is to treat everything. If a patient comes with joint pain, don't only think about joint pain. Give him anti-aging advice. And that will tremendously boost. And the patient will not come back to you frequently. And the disease may not recur. Now see this example of hormonal treatment. Twin number 2. This is identical twins. Twin number 1 without hormonal replacement therapy. Number 2 is with hormonal replacement therapy. You could easily see the difference. It's not only for women, even for men. There are a lot of hormone replacement therapies we can do, like growth hormone and like testosterone gel applications, which have proven benefits and which I have experienced with my patients. So I would like to, this is my last slide or so. I will try to give you a take-home message. Though I have talked everything, there are few things that you can tell your patients and you can practice, which is proven. At least 16 hours a day. As I said, physical exercise, 1 hour a day, including strength training, muscle development exercise. You have to develop your muscles. And sugar consumption. Actually, sugar is a killer. High sugar levels destroy the endothelial lining and lead into more disease. you tell anybody, any of your patients, including you, to stop caloric intake, to stop sugar completely for 1 month. Take a snap before and after, you compare and see. I have done this to many of my patients. There's a tremendous benefit. You look younger, you look smarter, the puffness of face goes, your pigmentation reduces, and there are tremendous benefits which I have observed. The other thing is green tea. It's such a unique product. I don't know whether you know the difference of green tea and the black tea. The difference is that green tea, you take 1.5 top leaf. In the black tea, you may take more than that. The most important thing is green tea, you only dry it. You don't mix it, grind it. The black tea you grind. So when you grind the black tea, there are enzymes inside the cells which act on tea. So certain good chemicals are lost in black tea. So that is the difference. You grind here, there you don't grind. Then there are some herbal medicines like moringa, cannabis oil seems to have anti-aging effects. It is not cannabis smoking. I have done a lot of observational research on cannabis smoking. What happens is, why cannabis is bad is, when you smoke cannabis, the smoke is the one giving all the atherosclerosis and other problems. But if you take the tetrachlorocannabinoids or cannabidiols, the liquid, that can have some anti-aging activity. It's not for leisure, but we can use it for treatment under control guidance. And vitamins. You have to take high dose vitamins, which should include zinc, vitamin A, and magnesium. And you have to take from a reliable source, because most of the vitamins, those they say vitamins, we really don't know whether vitamins are there. And another important thing is sleep. Today we sleep very much less because of televisions and cell phones and etc. But those days we had nothing to do after 9 o'clock. We used to have good sleep. When you're young, you sleep well, but when you're old, you don't. So if you have the luxury, you have to sleep after lunch. When you are sleeping, only body repairs and there's a growth hormone surge. Lastly, all my experience, I have put into a book. It's called the Longevity Code, which will be published internationally. I'm happy to say an international publisher has agreed to publish this book. It is not yet complete, but you can use this web link, and you can go into this link, and we are hoping to upgrade it, and you can get free advice on anti-aging care. And lastly, we have made on your table, kept on your table, some anti-aging products which we have manufactured using Sri Lankan material and Sri Lankan technology, Murunga, green tea, and some herbal creams which hopefully will reduce your aging. Thank you so much for listening to me.
Thank you, sir, for that insightful presentation. Ladies and gentlemen, as we approach the conclusion of this evening's proceedings, I would like to take this opportunity to remind you all regarding filling out the card of well wishes placed at your tables. Please be sure to include your name and contact details. Thank you. We now invite Dr. Kanti Aryaratna, Joint Secretary of the IMPA, to deliver the vote of thanks.